the work and life balance is like the main role is of family. Actually, the family should get normally understand that as a doctor, we are always should be ready for the patient.
Exactly. So आज के हमारे जो गेस्ट है वो है डॉक्टर संजय अल्ले सर. थैंक यू सो मच फॉर योर टाइम.
थैंक यू.
तो सर हमने कुछ क्वेश्चन जॉट डाउन किए तो हमारे व्यूअर्स का डाउट क्लियर करेंगे.
ओके.
So first we'll start with the introduction.
Hello everyone, this is Dr. Sanjay Ali. Basically, मैं वर्ली में प्रैक्टिस करता हूँ. I'm Orthopedic Surgeon. I am graduated from MGM Medical College and post graduation is from Somaiya Medical College. After that, I have done my fellowship from Hinduja Hospital and also I have worked in many government BMC hospitals. So since I am practicing since 10 years, so I have seen many patients related to orthopedic.
Okay, so very well answered, sir. Moving to our next question, why MBBS as a career?
Oh, that's a good question. So MBBS, why I choose an MBBS as such? So since my childhood, I used to live in a slum area. So I have seen many diseases around me.
Yeah.
Personally, also I have suffered many small disease element in my childhood.
Right.
So we used to visit a doctor. Okay. There used to be a huge number of patients in my child. I used to see at my nearby clinics.
Yeah.
So there was but might be because of the non-cleanliness in that area. Okay. So there was a drainage duct just outside my house.
Yeah.
So there are many issues which led to many diseases around our area. So that triggered me that I should also pursue a medical field. So the first step was like MBBS. So after around 10th, actually it started from the 9th standard. So I had got inspired with many doctors, and I used to hear that doctor is a noble profession.
Right.
So and I thought that this is one of the field which I can choose. So from 9th standard it got triggered that I should become a doctor, though it was a long process. Okay. So from the 9th standard I got that I should be a medicine, and step by step I took a guidance from many doctors for how I would should pursue the MBBS, and along with that many have helped me.
Yeah.
So that was the intention of being coming into the medicine field as such.
So your environment was one of the reasons you took up MBBS.
Yes,
MBBS especially. Okay. So moving on to our next question. So as you are in this profession for 10 years, right?
Exactly.
So how is your work-life balance during the hospital days?
So as we all know that we get a call midnight 1 o'clock or at early morning 4 o'clock also.
Exactly.
Okay. So what the patient expect is whenever they have a problem,
right?
Mainly because I'm into orthopedics, so there are many emergency cases. So they expect that whenever they get a any problem, emergency problem, the doctor should attend.
Right.
So there are many incidents that I get a call when just I reach my home at late night around 1 o'clock. Then I get a call from any patient that we met with an accident, so it's a severe condition. So please come. So all patient might not aware of that we work throughout the day and just reach home. Their expectation is that we should attend as soon as possible when they are in a problem.
Yeah.
That is very understandable. So the work and life balance is like the main role is of family. Actually, the family should get normally understand that as a doctor, we are always should be ready for the patient.
Exactly.
So in that sense, normally whenever we get a time, mainly we get times in the weekend sometime. So we have some other activities. So every doctor should develop some particular extra other than this profession. I normally play sports like cricket or some football, something like that. So that makes me like I have some other activity also.
Yeah.
So practicing Monday to Saturday doesn't make that much hectic. So whenever we have a break time, so that charges again. So that's the one most of the doctor does. So I think the young doctor should also do that.
Right. So family support and extracurricular activities.
Exactly.
Okay. So moving on to the next question. As you mentioned, you are orthopedic, right?
Yes.
So what was the reason behind choosing this particular specialty?
Whenever any young when we enter into the MBBS, okay.
Right.
So nowadays everyone should aim that MBBS should not be the first step. It should be this, that post graduation should be the ultimate step.
Yeah.
So MBBS is just a basic for the medicine.
Right.
So why I've chosen orthopedic as such? It depends upon how much you're keen in particular field. So when I was in my MBBS undergraduate, so we have a 1 year of internship after the MBBS.
Okay.
So that is the period we work in every department.
Okay.
So at that time, any MBBS doctor will come to know that which field is suitable to us.
Right.
And plus, I was more interested in surgical field. Okay. So because of that, I thought the orthopedic is a good option. So luckily, I got that after my PG or after MBBS. So in the first attempt only, I got that orthopedic. So I took the orthopedic.
So was there any confusion? Like every student faces confusion, like
Exactly.
which stream, which specialty to choose, right?
Exactly.
So were you very clear?
No, I was not very clear at after my MBBS. So I was confused between because I was sure there are actually there are non-surgical and surgical field as such.
Okay.
So I was not sure which field is better for me.
Okay.
But during the internship period, I got to know that I'm very much well versed with the surgical part.
Okay.
So medicine, I was not that confident in the medicine part. So every MBBS students after completion of MBBS, they do get a confusion that which field we should select.
Right.
I think one prime reason we should have which field we should select is like what are we best in. Okay. So if some medicine student is best in the medicine part, then though we might be having an interest in surgical, you should go to the medicine part.
Exactly.
So from the day one when I was in MBBS, so the surgery is related to somewhat anatomy. Okay. So I was good in anatomy. So that has inspired to take into my surgical field. So after that also I took many advices from my seniors, also from my lecturer, my professors,
Right.
and my nearby doctors. So all have advised the same, like whenever you have any particular interest in some field, and along with that, if my academic is also good in that, so that field we should select actually.
Exactly.
Otherwise what happens is we are not good in some particular academics and we are taking that stream. For the long term, it is not good like that.
Exactly. So interest lags in that particular.
Exactly. One is first, the main point is we should have an interest in that.
Right.
Yeah. So because when we have an interest, then we enjoy the practice.
Process, yeah.
Because per day, as orthopedic surgeon, we attend the surgeries, we attend the outpatient department. So we have a family also.
Yeah.
So if we don't have an interest, then that becomes very hectic. If we have an interest, that doesn't feel that we have much work.
Right. So internships and your mentors
Exactly.
guide you through it.
Exactly.
Yeah.